Good morning and welcome to Health Talk, sponsored by Mon General Hospital. This program is designed to provide education on vital health topics to help you take charge of your health. You'll also be introduced to Mon General's committed physicians, allied healthcare professionals, and quality programs and services. And now, here are your Health Talk hosts, Kay Murray and Jim Stallings.
I'm Jim.
I'm Kay.
And this is Health Talk on Mon General on WAJR. And today our guest is Dr. Melanie Casey in the studio this morning with Cardinal Pediatrics. And I remember talking to, maybe you were in the studio last time we talked with Cardinal Pediatrics, right?
No, I think that was Dr. Wood.
Oh, okay. Well, welcome to the program.
Well,
you look
thanks.
familiar to me, although I can't see you around the computer here. Let's talk about Cardinal Pediatrics. It's right around the corner from where I live at Cheat Lake, I see.
Oh, yeah. So we have two new locations. One is in Suncrest Town Center, and the other one is in Cheat Lake. It's, I guess if the Little Bridge was there, it'd be easier to get to, but it's by Ashbrook Square, and it's phenomenal location, and both the offices are just beautiful.
Now, talk about your relationship with Mon General Hospital, between Cardinal Pediatrics and Mon General, because there is some kind of connection there, right?
Oh, yeah. The wonderful thing about being at Cardinal and working for Mon General is that when we have a sick patient, we get to take care of that patient in the hospital at Mon General, and we get to be if we know one of our patients is getting ready to have a baby, we get to be there at the births, and it's a wonderful way to start life with your pediatrician right there next to you, and the parents appreciate it very much.
And most pediatrics or pediatricians, I think, have their own standalone business and not associated with hospitals. So what is the advantage, again, do you think, for parents that you have this relationship with Mon General?
Well, I think certainly if you go to the emergency room, any emergency room, they'll call the doctor that's on call. And for us, being associated with Mon General and working with them, we are always called for our patients. So you always get to see a familiar face when you're at the clinic, or whether you're in the emergency room or if you're inpatient. And we have 6 providers at Cardinal, so you're always guaranteed to see someone and see a familiar face.
6 providers. So tell us what you provide, what type of services are covered.
We do pediatrics, so we like to see children from birth to 21. And with some of the Obamacare, we may be able to see some of the kids, I say, a little bit longer too. And we really enjoy that. We have wonderful hours and very accommodating hours. We're open from 8 to 8 every day, Monday through Friday, and we're also open on Saturdays.
All right, we know that pediatricians deal mostly with children. I know among us adults, Kay, there's something going around.
As we all sound this
I know,
morning.
we do, both of us. Kay and I have the same thing.
Yeah.
I have
happening.
what I call a mild cold. It's almost more of a nuisance than one where I really want to go to bed or
It's
anything.
all kind of in the eyes.
Yeah,
and nose,
and I'm in my nose. But what about kids? Is something going around with kids? Did I get this from a kid?
I'm sure you did. Have you been to the mall lately?
Yes.
He has them coming into the house, too. So.
What did I touch? I mean, I didn't even talk to people. I'm just wondering if I touched something that was previously touched by somebody who put the germ there.
You see
Is
what the
this
doctor
yours?
has.
Yeah, that's
This
in
is
here
your
for a
hand
reason.
sanitizer.
I do use it all the time,
I
especially
see you
in
bathing
here.
in it earlier.
Yeah, that's right. I love to fill a tub with that stuff. It's so gooey.
But something good to carry around with you at all times.
Yes, I don't know. I'm not as good with the hand sanitizer, but I'm kind of a pathological hand washer because I wash them before patient, after patient. Here I am. I'm still sick, so
You do everything you can.
you try, yeah. And so what we're seeing right now is something called RSV, and it's to make a long story short, it's a horrible chest cold, and it causes even people that don't wheeze and sputter to sound like they're 100-year-old men that have smoked a pack of cigarettes their entire life every day.
So we can still get it.
Yes, you can say, well, and the kids, it can be really rough on them. They wheeze, they have a hard time breathing, and the older kids, it's more of a nuisance, and our babies, our young kids with congenital heart disease, kids that are born early, premature kids, it can be quite serious. So that's what we're seeing in our clinic every day, every night.
Going back to hand washing, and I know hand washing's great and the sanitizer and all that, but does that weaken the body's natural defense system?
Hand washing, I would have to say, really doesn't, and that's probably the best way to ward off illness is just remembering that if you wash your hands and wash them appropriately, which isn't just like all 4 of my kids do, stick them under the water, take them out, and say,
Do
okay,
your
I'm
ABCs.
done.
Do your
That's
ABCs.
right. But as far as the hand sanitizer, it's really just alcohol.
Yeah, I just don't
And
want
Jim
to.
believes in that.
I take a bath in it and I drink it. Double duty there.
Save water.
All right, so really the germs that are going around there, we'll wash our hands because we're touching things that other people have touched. It doesn't
Right.
necessarily mean they sneezed in our face.
Exactly.
But how long does a germ that's bad for us stay on a surface?
That's interesting. The RSV virus can actually stay on a surface and exist. So, yeah, Kay's rolling her eyes. Oh, no.
great.
Really good to know. So that's why, when we go to the mall and my kids go to the mall playground, I mean, they always come home with something interesting. Like 2 days later, they're always sick. But it's not a big deal. Their bodies fight it off, and, they usually do fine.
Of course, we get this on our hands, and then we wipe the tears from our eyes,
Right,
and
or
we
we
take
touch
it
our
all
noses.
up to our
Yep.
eyes, and we just keep
Yep.
it going. But children do get into areas when they're not going to wash their hands correctly all the time.
No.
And they're not going to use the sanitizer, and they're in school, or they're in daycare, or they're going up to the mall to the play area, and there's just germs out there. That's all there is
Yep,
to it. They're going
and-
to get it.
I guess that's why I have a job.
That's right. Thank goodness for you to be there. But
That's right.
this leads us into the flu. Let's talk
Yeah.
a bit
Could you
about
hand me
the
the
flu.
hand sanitizer before?
See, I knew you wanted
See,
that.
he's freaking out right now. So.
You say it lives a long time on the surface.
Why do you believe Hoppy Kercheval comes in here every day and cleanses?
Oh, I know. He does that
everything?
whether there's something going around or
Well,
not.
absolutely he does, and that's why he doesn't get sick a
that's
whole lot.
OCD.
Well, a little bit of that. But
As
the
he
flu,
puts his hand sanitizer on.
flu shot still, is it too late or it's still worthwhile?
No, it's definitely worthwhile still because we haven't seen a lot of flu in our area yet. And I mean, obviously, it's a pretty easy thing to spot: chills, fever, sore throat, horrible cough, runny nose. But we've got these rapid flu tests in the office. So if we're not sure, we can do a nasal swab and get this snot, if you will.
Yeah,
and
that'll
just
do
put
it.
right on
Explains it
there,
right
yep,
there.
and then it'll tell us if you've got and our flu tests have been negative, and then the CDC and the local health departments will put out, hey, you know what, there's flu here, there's not flu here, and we just haven't seen a whole lot of it. So yes, get your flu shot now while you can, because
Good.
that'll give you a couple weeks to build up an immunity, and it's so worth it because that way, I mean, the flu itself is just miserable. But you can get a secondary complication. We see kids coming in after the flu, getting pneumonia, having ear infections.
Goes into other problems.
Oh yeah, and then the parents, of course, they get it, and then the mom misses a week of work, and then the dad misses a week of work, and then the kid misses school, so the mom has to miss another week of work, or the dad has to. And so getting that flu shot is important for many different reasons.
I think, let me just ask one question. It's about when to take that child to the doctor, because I think parents deal with this all the time. You think, well, they're going to get over it. They have a low-grade fever. Give them a few days. When is the right time to say, okay, now I better get my kid into a doctor?
The more kids you have, it's easier to figure this out.
I guess.
But the first time parents are usually pretty quick to come in, and we always encourage people to come in. So even if we get to look at your child and say, you know what, Mrs. Smith, your child has a cold, and these are 10 things you can do to make this child feel better. So I think that's worth coming in just to have that reassurance. But if your child's fever has persisted for a number of days, if your child's not drinking and eating appropriately, those are all good reasons to come in, because you don't want to have a child that has dehydration, that the minute they walk into your office, you say, well, geez, there's not much I can do but put this child in the hospital. There's so many steps that we as pediatricians and our nurses can do beforehand to keep your child out of the hospital. And that's primarily what we do at Cardinal. We do outpatient pediatrics, and we do inpatient as well when the kid's health crosses the line. But we try very hard to keep our kids healthy and out of the hospital.
Dr. Melanie Casey, our guest this morning with Cardinal Pediatrics, and thank you for not using doctor terms and those big words
I like the word
that we
snot.
get here. I
That's
was
one
going
of
to
my
say
favorite words.
I love that
snot
word.
is
I
a
love that
great
word. That's one of my favorites.
It's
I
just-
understood
Well, I
it.
have other ones too.
It's just fun to say too. So here's an exercise for the listening audience for a little therapy, just during the break a little bit, just say snot every now and then because it just feels good.
And hand sanitizer.
And hand sanitizer. You know how when you see water on television or something and, oh, wow, I got to go to the bathroom. We were talking about snot, and I got to go blow my nose. I don't know if there's any kind of connection there, but I'll do that during the break. We'll be back
And you
right
can
after
use your
this.
hand sanitizer.
Yes.
The doctors, the latest news and procedures. Your local health connection is Mon General's Health Talk. If you'd like to be on the show, call 304-296-0041.
We're killing germs here on Health Talk today. You won't find any in here, not with all this hand sanitizer and other wipes that we have in here. Welcome back to the program. Dr. Melanie Casey from Cardinal Pediatrics, 2 locations in the studio with us this morning. And let's talk a little bit about the moms that you take care of postpartum or post-birth. I guess that is postpartum, what that means, right?
Yeah, and before
Post-birth.
you answer that, give us your full name.
What? Oh, Melanie Casey, right?
All right.
There you go.
Did I say it wrong?
No, you
I
said
think
it
you
right.
said it perfect. Yeah, she was winking at me, so I just wanted to make sure we had everything perfect.
Okay. Hey, no secret codes going on between the women in here. Right, Greg? Or you and me will have to start doing winking and whatnot. I'll turn on your
Big
mic.
Jim. All right, thank you.
He's just agreeable with anything this morning.
All right. Postpartum depression.
Well, we see, the nice thing is we get to see these moms. We do rounds in the nursery, and we get to see these moms, and they're tired. They've just given birth to this baby, but 99% of the time they're elated. They can't believe they've got this baby. And then we see them again. All of us are advocates of breastfeeding, so we try to get these patients right out of the hospital into our office within 24 hours of discharge or 48 hours of discharge, especially first-time moms. And we teach them how to breastfeed. If they have a question, most of the women that are breastfeeding in the hospital quit by the time they go home because they just don't have that support. And so we get them in there and we get to talk to the moms. Well, by the time we see the moms, like 48 hours after they've been home, they're tired. They've had this really incredible birth experience, and they're looking a little peaked, a little tired, and the kids, for some reason, hadn't read the rule book about, the kid's supposed to sleep 23 hours a day. This kid's been awake 23 of the hours and nursing constantly, and we have the opportunity to come in and really take care of this mom. Moms that have babies usually don't see their health provider, their OBGYN, until 6 weeks after they have a baby. So we have a great opportunity to get to see this mom and this whoever the mom's with, boyfriend, the dad of the baby, husband, and we get to see this family every week while we're watching the baby grow and teaching breastfeeding. And a lot of times these moms, by about the 4th week, 6th week, even before the 2-month visit for the baby, these moms are tired and they're sleep deprived and they're anxious. You take this mom that was the most laid back woman in the world before she ever had a baby. She's anxious and she can't sleep, and even though she's tired and she's crying all the time, and sitting in your office, and that is we have the opportunity to refer that mom on to her primary care doctor.
You mentioned support, and of course the support of a doctor I understand. What about the support of a spouse or someone at home? Talk about how important that is, and what do you mean by support? Especially with the postpartum moms and moms that just had a baby, the sleep deprivation. So, if the mom is also breastfeeding, maybe the dad, he can't breastfeed the baby, but he can say, hey, you know what? After you're done breastfeeding, I'm going to take this baby for 3 hours, and you need to go take a nap. And so important.
Yes, it is. It really is. And a lot of people in this town don't have family right here. And the extended family is also important if you can have that.
I know that it is very important to breastfeed. Are women still choosing to do so, or are you finding more of a career woman that doesn't want to go through all the pumping and going through that's deciding not to? And is that okay in your mind?
Yeah, I think either one is fine. Of course, we advocate breastfeeding.
Which we all know that.
But I don't think I think a woman's bond with that baby, most women, I think 80% of women work these days, and only about 20% get to stay home. And of those 80% that are working, they get maternity leave. And if they're struggling for 6 to 8 weeks to breastfeed a baby and they're not bonding with that baby, I mean, we would say, you know what, just bottle feed.
For the mental health.
Enjoy and mental health of the baby, mental health of the mother. But if they want to learn to breastfeed, we can teach them.
I'm curious, is breastfeeding 50% offering nutrition to the child and 50% psychological, bonding, those other intangibles?
Yeah, I mean, the bonding is incredible. And, of course, there is that ability, I think, women, when they feed that baby and watch that baby grow, it's an amazing experience because they know that they're doing it.
Yep, so you are an advocate at Cardinal Pediatrics of breastfeeding. Why specifically?
Well, it's first of all, there's the bond. Then there's also at the beginning, especially at the beginning of breastfeeding, there's wonderful antibodies and just nutrients that we don't even know about to put in formula.
It's natural.
And it's very natural. And even it seems like the formula that comes out every year has a new additive. Oh, wait, we're going to add this because it's in breast milk. Oh, we're going to add this because it's in breast milk. And we've already got it, so it's already there.
And is it true that women lose weight faster if they breastfeed?
Oh, yeah. I mean, if you have a baby if you assume that baby is taking 80 to 100 calories per kilo per day, if you do it just right, this baby could be taking 1,000 calories. And I don't know. I mean, I think of everything in terms of Whoppers. That's like half a Whopper a day.
That's right.
Okay.
Yeah.
Or it could be like 4 candy bars. I mean, think about that.
Put it all together.
Yes, a big glass of chocolate milk.
Breastfeed for sure.
I know. And probably a quarter of a Cinnabon.
There you go.
So there you go.
Got you covered, baby.
All right, we're going to take a break. You're listening to Health Talk, brought to you by Mon General and WAJR.
This is Mon General's Health Talk, providing the information you need to take charge of your health. Call us now with your health-related questions at 304-296-0041.
Dr. Melanie Casey
Perfect. That's good.
is our
great.
guest today here on WAJR. Pediatricians, we're learning, aren't just for taking your kid to see because they swallowed a part of a toy or shoved something up their nose. When it comes to adolescent care, I know that was a great lead-in for this segment right here. When it comes to adolescent care, I mean, pediatricians go a lot further than just treating those baby boo-boos.
That's true. The adolescent population that we have at Cardinal is wonderful, and it personally is one of my favorite parts of pediatrics. I mean, adolescents have it rough these days, and we used to think that teenage angst was just that, teenage angst, and we're coming to find that many of these teenagers are truly clinically depressed, and there are not a lot of services for depressed teenagers in this area, and the pediatrician is a great resource. I probably see more teens with ADHD, which is attention deficit disorder, and depression, anxiety, and they manifest those things by social isolation. They cut themselves. They cry all the time, which I have a 13-year-old daughter. There's no lack of crying in my house.
We need to do a whole show on this.
Oh, yeah.
Seriously, we
Oh,
do.
yeah.
Just to focus in on teens and signs of what you can look out for. And you talk about the cutting and different things that teens are doing to
yeah.
themselves. And I think there's a lot of pressures.
And then they
out there.
self-medicate. They drink or they do drugs or they have sex or they do things to make themselves feel better, and it doesn't help.
Tattoos and piercings.
We just
Which we were
talked
talking
about that.
yesterday.
Things that
We
they
used to
do.
talk about people accessorizing, putting more charms on the bracelet. Now accessorizing is getting another piercing or another tattoo.
Seriously, we need to do another show just on that and focus in on
yeah.
helping our teens out there.
I agree, and I love that part of my job. Just to have those moms and dads and teenagers in there together, and just to say to the parents, "Hey, take this seriously."
All right, we have about 30 seconds left. So how do we find you in this great big world?
Well, you could look on the internet because we have a website under Cardinal Pediatrics, and we're all on there, the 4 doctors and the 2 nurse practitioners, and we would love to see all of you guys and all of your kids.
And the video of this show will be available coming up soon on the website, mongeneral.com, and you're going to be on there.
I can't wait.
All
With
right.
all of our watery eyes.
You've been
right.
listening to Health
With our-
Talk on
with our
WAJR.